But here's where it gets controversial. Nebraska's recent report reveals that youth with mental health needs are increasingly being sent to adult facilities, despite a growing gap in care, sparking debates over whether institutionalization is the right path for these vulnerable children. This year's findings, which span July 2024 to June 2025, highlight alarming trends. The report notes a 110% surge in solitary confinement hours for youth, alongside a slight rise in child deaths, pushing the number of mandatory investigations to 32. These numbers underscore a systemic issue. Over 70% of youths are being committed to Nebraska's 3 Youth Regional Treatment Centers, YRTCs, nearing their capacity limits, which has led to a spike in staff assaults. Inspector General Jennifer Carter of the Nebraska Office of the Inspector General for Child Welfare emphasized that 4 of these assaults occurred within a 3-week period at Lincoln's facility. She stressed that lawmakers may have to step in to address the resource shortages at YRTCs, as these centers are struggling to meet the demand for specialized care. CenterPointe Crisis Services Director Ashley Chisholm explained that the approach to youth mental health treatment differs significantly from traditional models. There's a clear need for these services, she said, noting that sometimes youth lack safe spaces to escape their environments. Parents and families often need a break, but there's no place for them to go. To bridge this gap, CenterPointe is launching Square One, a program that will add 4 more respite beds to Lincoln, offering temporary shelter for youth in need. The OIG's report also revealed that 3 children were placed in the Lincoln Regional Center, a state-run adult facility, this year, raising questions about the continuum of care for youth with severe psychiatric needs. Carter reiterated that while the regional center aims to separate juveniles from adults, sending children there signals a critical failure in the system. Judges sometimes face a dilemma when there's no juvenile service or facility to serve these youth, she said. We don't want to institutionalize children unnecessarily, but we've asked the legislature to consider adding a youth facility. Carter acknowledged that such a facility wouldn't need to be large-scale, but she emphasized the urgent need for a significant service gap. The full report can be accessed here. Link: https://nebraskalegislature.gov Floor Docs 109 PDF Agencies Inspector General of Nebraska Child Welfare 285-20-50-915-12259 PDF. Also, stay tuned for Night Beat with Danielle Schenk. Subscribe to our daily newsletter at link https://www.1011now.com. Copyright 2025 KOLN. All rights reserved.